Good day everyone. It is nice to see you again. Welcome to our Any Learning, as our learning community. Lesson 3. Care of clients under emergency situation. Environmental emergencies. Airway obstruction. Acute upper airway obstruction is a life-threatening medical emergency. The airway may be partially or completely occluded. If the airway is completely obstructed, permanent brain damage or death will occur within 3 to 5 minutes secondary to hypoxia. Partial obstruction of the airway can lead to progressive hypoxia, hypothermia, and respiratory and cardiac arrest. Assessment include the following: choking, apprehensive appearance, inspiratory and expiratory stridor, labored breathing, use of accessory muscles, suprasternal and intercostal retraction, flaring nostrils, increasing anxiety, restlessness, confusion, cyanosis and loss of consciousness develop as hypoxia worsens. Assessment of the patient who has a foreign object occluding the airway may involve simply asking the person whether he or she is choking and requires help. If the person is unconscious, inspection of the oropharynx may reveal the offending object. X-rays, laryngoscopy, or bronchoscopy also may be performed. Interventions for airway obstruction include the following. Establishing an airway may be as simple as repositioning the patient's head to prevent the tongue from obstructing the pharynx. Alternatively, other maneuvers, such as abdominal thrusts, the head tilt chin lift maneuver, the jaw thrust maneuver, or insertion of specialized equipment may be needed to open the airway, remove a foreign body, or maintain the airway. The Heimlich maneuver, also diaphragmatic abdominal thrusts, is recommended for relieving foreign body airway obstruction in the adult. The following presentation shows the steps of all maneuvers. Take note. In all maneuvers, the cervical spine must be protected from injury. Heimlich maneuver, also diaphragmatic abdominal thrusts. For standing or sitting conscious patient, stand behind the patient, wrap your arms around the patient's waist, make a fist, placing thumb side of the fist against the patient's abdomen, in the midline slightly above the umbilicus, and well below the xiphoid process. Make a quick inward and upward thrust. Each thrust is separated. Figure 6 shows the diaphragmatic abdominal thrusts. The rescuer stands behind the victim and grasps his hands firmly over the victim's abdomen just below the rib cage. The position of the rescuer's hands and the direction of thrust are shown at the bottom right. For patient lying, unconscious, position patient at the back, supine, kneel astride the patient's thigh. Place heel of one hand against the patient's abdomen. Place the second hand directly on the top of the fist. Make a quick upward thrust. Finger sweep. Used only in unconscious adult client. Make a tongue jaw lift. Opening the patient's mouth by grasping both tongue and lower jaw between the thumb and fingers and lifting the mandible. Insert index finger of other hand to scrape across the back of the throat. Use a hooking action. Chest thrust. Used only in patients in advanced stages of pregnancy or in markedly obese clients. Conscious patients standing or sitting. Stand behind the client with arms under patient's axilla to encircle patient's chest. Place thumb side of fist on the middle of sternum. Grasp with the other hand and perform backward thrust until foreign body is expelled. Injuries to bones and joints. Injuries to bones and joints are common. Fractures may be caused by direct trauma, for instance, projectiles, crush injuries, or by indirect trauma. For further definition, bones being pulled apart or rotational forces. In addition, bones may be fractured due to pathologic reasons. A pathologic fracture is due to a weakness in the bone secondary to a disease process such as metastatic cancer. Other injuries include 1. Dislocation. a complete displacement or separation of a bone from its normal place of articulation. It may be associated with a tearing of the ligaments. The shoulder, elbow, fingers, hips, and ankles are the joints most frequently affected. 2. Subluxation, a partial disruption of the articulating surfaces. 3. Sprains, an injuries in which ligaments are partially torn or stretched. These types of injuries are usually caused by a twisting of a joint beyond its normal range of motion. And 4. Strains, a stretching or tearing of muscle and tendon fibers, usually caused by overexertion or overextension. Assessment includes the following: pain and tenderness over the fracture site, a grating or crepitus over the fracture site, swelling due to internal bleeding and edema, deformity, unnatural position or movement where there is no joint, discoloration due to bleeding into the surrounding tissue, shortening of an extremity or rotation of the extremity. Interventions includes the following: immobilize the injury. This will prevent further damage and will help to relieve the pain. Elevate to prevent or limit swelling. Apply ice packs or cold compresses. Ice should not be placed directly on the skin. Splint the extremity in as good alignment as possible until definitive care is complete. Immobilize the joint above and below the fracture. Handle the part gently and as little as possible. Pain management may include ice packs, simple or opioid analgesics, non-steroidal anti-inflammatory drugs, or regional nerve blocks. Assess for signs of compartment syndrome. Abdominal injuries. Abdominal injuries account for a large percentage of trauma-related injuries and deaths. Damage to a hollow organ can result in acute peritonitis leading to shock within a few hours, and damage to a solid organ can result in lethal hemorrhage. Abdominal injuries may be classified as either penetrating or blunt. 1. Penetrating abdominal injury, usually the result of gunshot wounds or stab wounds. The mechanism that caused the penetrating abdominal trauma may cross the diaphragm and enter the chest. 2. Blunt abdominal injury, usually caused by motor vehicle accidents or falls, causes more delayed complications, especially if there is injury to liver, spleen, or blood vessels, which can lead to substantial blood loss into the peritoneal cavity. Assessment includes the following: obvious signs of injury, penetrating injury, bruises, tenderness, rebound tenderness, guarding, rigidity and spasm. Cares sign. A pain radiating to the left shoulder may be a sign of blood beneath the left diaphragm. Pain in right shoulder can result from laceration of liver. Cullen sign. A slight bluish discoloration around the navel is a sign of hemiperitoneum. Interventions includes the following: control bleeding, maintain blood volume, and prevent infection. Cover protruding abdominal viscera. Do not attempt to replace the protruding organs into the abdomen. Use sterile saline dressings to protect viscera from drying. Cover open wounds with dry dressings. Cut the clothing away from the wound. Do not cut through bullet holes or stab marks. These will be needed by law enforcement authorities as forensic evidence. Thank you for listening. Have a good day and be safe. Agyamanag.